Tim Davies left home today thinking he'd be getting the first of 2 doses of the Pfizer vaccine. He was devastated when he got to the clinic and was told his second jab, set for 21 days' time, had been postponed.
I was quietened. My heart had been bumping with enthusiasm and delight, and it slowed down. And I came out pensive, and I wasn't smiling behind my mask when I spoke to my wife. She knew straight away that something was wrong, and I said, I'm very worried about what is happening. I'm not sure that this regime is the one that the regulatory authority sanctioned when they gave the go-ahead for this vaccine.
Yesterday, the government changed its guidelines on the Pfizer vaccine. The advice had been to give 2 doses within 3 weeks of each other for best protection. Now they say within 3 months. And GPs told us the change is at best confusing, at worst off-putting.
When you're going through the consent and explaining the treatment and the importance of getting that second vaccine and the importance of having it 3 to 4 weeks afterwards, and now suddenly the news comes out that that's changed and don't worry, it is fine just to have it 12 weeks later, I think that's going to cause a lot of worry and confusion amongst patients.
The new government strategy aims to get more people a first dose faster. But does that compromise protection? Pfizer says their 95% coverage is based on 2 doses within 21 days, and that the safety and efficacy of the vaccine has not been evaluated on different dosing schedules. There are no data to demonstrate that protection after the first dose is sustained after 21 days. In response, the MHRA, which says how and what vaccines can be used, told us the new advice was based on clinical trial data that showed the vaccine was 90.5% effective against preventing COVID-19 after the first dose. And there was no evidence to suggest that the effectiveness of the vaccine is declining towards the end of the 21-day period. And virologist Julian Tang believes in this crisis situation, it is the best approach.
We know from the collective experience of decades of vaccination experience that the first dose immune response will not disappear if you don't have the second dose within 3 weeks. This first dose initiative is actually not a bad idea to try and suppress the virus from overwhelming the healthcare services and infecting the vulnerable before we can get to them with even the first dose. So, a pandemic situation requires some flexibility. And I think this is not unreasonable given the situation.
That's a situation where speed and efficacy have to be balanced. Nearly 1 million people have had the COVID-19 vaccine so far. There are many millions to go. Caterina Potozzi, Sky News.